Imagine this. You've been eating well, exercising, and losing weight, yet your blood pressure keeps climbing higher and higher. But what if your blood pressure isn't from stress, too much salt, or just your age, but rather from a hidden condition that's silently driving those numbers higher and higher? I'm Dr. Mitch Rice, board certified primary care physician, and today we're exposing 3 hidden causes or suspects of high blood pressure that often get missed, and spotting any one of these could honestly save your life. Suspect number 1 is called the salt hoarder, and this has everything to do with your adrenal glands. These are 2 small glands that sit on top of your kidneys and produce a hormone called aldosterone. Now, the job of aldosterone is to communicate with your kidneys to hold on to salt and water in the body. When you have an overactive adrenal gland, it can produce too much of this aldosterone hormone, and this is known as primary hyperaldosteronism. The effects of this are more sodium staying inside your body, and wherever sodium goes, water will follow, so more water becomes absorbed in the body, and your blood volume increases because there's more fluid in the pipes. As a result of all of these things, your blood pressure will continue to rise. So what's the big deal? My blood pressure may rise a little bit. I'm not scared. If primary hyperaldosteronism is left untreated, it can cause muscle weakness, heart rhythm issues, and permanent kidney damage over time. And the thing is, just like all 3 of these hidden causes, primary hyperaldosteronism is 100% treatable. So if you have blood pressure that continues to be elevated despite being on multiple medications, if you have low potassium on your blood work, even slightly low, or if you're feeling unusually weak, crampy, or fatigued, this is something that you definitely want to bring up to your doctor and ask them if your high blood pressure could be due to suspect number 1, the salt hoarder. Suspect number 2 is called the kidney pincher. Your kidneys don't just filter out waste, they also act like tiny little blood pressure sensors. To do their job, they need a steady stream of blood flow. Not too much, but not too little. If the main highway bringing blood into the kidney starts to narrow due to plaque buildup over 20 or 30 years, the kidneys think something is wrong and they begin to panic. Because that main artery gets narrower, the kidneys will think you're dehydrated even if you're not, and it flips an emergency switch. This emergency switch tightens all the blood vessels in the body. It also tells aldosterone to kick into high gear, which causes your body to retain more salt and water, like we saw from the salt hoarder. The combination of these things pushes your blood pressure sky high. The kidney pincher, also known as renal artery stenosis, can lead to spikes in the blood pressure that are very difficult to control. If this is left untreated, it can cause permanent kidney damage, ultimately leading to dialysis. And the awesome thing about finding out if you have the kidney pincher is that solving the problem will fix your blood pressure most of the time. So if you have blood pressure that jumps up suddenly without a real good explanation, or your doctor hears a whooshing sound in your belly when they listen with a stethoscope, or if you have a significant bump in your kidney numbers right after starting specific blood pressure medicines like ACE inhibitors or ARBs, then this is definitely something that you want to bring up to your doctor and ask them if your high blood pressure could be due to suspect number 2, the kidney pincher. And suspect number 3 is called the lead foot. This suspect has everything to do with your thyroid. Your thyroid controls the speed of your metabolism. Think of your thyroid as the gas and brakes on a car. To speed it up, you press the gas, and the thyroid makes more hormone to increase metabolism. To slow it down, you hit the brakes, and the thyroid makes less hormone to decrease metabolism. When it's overactive, like in hyperthyroidism, that means there's a lead foot on the gas pedal, and therefore everything speeds up. Your heart rate, your metabolism, and yes, your blood pressure. Uncontrolled hyperthyroidism can cause dangerous heart rhythms such as AFib, speed up the wear and tear on your arteries and your heart. But the good news is that hyperthyroidism is 100% treatable, whether it's with medication, radioactive iodine, or surgery, and this often treats blood pressure effectively. So if you have a resting heart rate over 90 beats per minute, if you feel hot, sweaty, or jittery all the time, if you have some tremors, anxiety, sleeping issues, and unexplained weight loss, then this is definitely something that you want to bring up to your doctor and ask them if your blood pressure could be due to suspect number 3, the lead foot. Now, if you can't remember everything that we talked about today, that's totally fine. I put together a free PDF talking about the 3 hidden causes of high blood pressure, and you can check that out completely for free in the link below. No matter the reason that your blood pressure is high, there are certain things that you can do right now to lower your blood pressure in less than 2 minutes. If you haven't checked out that video, I definitely would recommend it right here. It's 3 tricks to instantly lower your blood pressure.